Position yourself appropriately behind the patient's head. Position a small towel under the patient's head to ensure a neutral position. Perform a triple airway manoeuvre and inspect for any visible obstructions. The equipment required for an LMA insertion includes a small towel if appropriate, a laryngoscope, appropriate LMA size, a 50ml syringe, bite block, lubricant, tubing tape, and APPV bag. Perform a laryngoscopy to ensure airway is patent and that there are no obstructions visible. Select the appropriate size of the LMA and inspect for signs of damage. This patient looked to be approximately 50 to 70 kilograms, therefore I used a size 4 for a normal adult, which has a maximum inflation of 35 mils. I attach the 50ml syringe and pull back on the plunger to ensure that there is no residual air in the LMA. I then adjust the size of the plunger to 35 mils and inflate the cuff until any dimples disappear. This may not require the whole 35 mils. I then proceed to lubricate the surfaces of the LMA to reduce friction. I utilise a jaw thrust while advancing the LMA into its appropriate position, with the back of the mask pushing against the hard palate. Some pressure is required to proceed the LMA, but not too much. Once deemed to be in the appropriate position, a bite block is inserted and the LMA is secured with appropriate tubing tape. Ensure that the LMA is sitting centrally and attach the APPV bag. When ventilating the patient during an arrest with an LMA inserted, a rate of 15 compressions to 1 ventilation is required with no pause for the ventilation. Look for rise and fall of the patient's chest to ensure that the LMA is in the appropriate position.